The biggest issue really is trying to get in initially.
Lacey Jorgensen, a UNI student, has been seeing a counselor at the counseling center for about a month. It took a week and a half for them to schedule an initial assessment and a week later for another appointment. The stress of classes and some depression were the main reasons Jorgensen chose to seek counseling.
It's stressful being a student, and I work two jobs part-time, and finances are always an issue, and a variety of other things, class stress, extracurriculars, relationships, family dynamics.
There has been an increase in the number of students using the counseling center this semester. The cold winter and the stress of school have been the main factors. In addition to the number of students coming in, the counseling center's budget does not continue to increase.
In the last couple of years, as the enrollment challenges have hit the university, we've received less money from the mandatory health fee because there are less students enrolled paying the fee. And so that has cut our budget a little bit.
Students can choose how they want to do the appointments depending on their kinds of issues and their availability. Jorgensen sees a counselor on a weekly basis. Though she says she feels better after a counseling session, Jorgensen feels there is room for the counseling center to better accommodate student needs.
If they had a larger staff available, I just feel like they would be able to help more students. And I mean, maybe because I know that they have expressed that I was told that they were, pretty well booked. But they still managed to squeeze students in and stuff. And so I feel like if they had even one or two extra counselors on staff, I feel like they would be able to accomplish more.
Jorgensen feels more students should take advantage of what the counseling center has to offer, since students pay for these fees as part of their tuition.
I feel like overall, going to counseling is beneficial, and it does help a lot of students.
The counseling center continues to improve their accommodations for the students. They are currently investigating the use of a system called Protocol. Protocol is an after-hours phone service which uses graduate-level counselors and social workers to respond to phone calls. If the counseling center were to contract with Protocol, UNI students would be able to talk directly to a counselor after the counseling center has closed. Now, this Protocol service would cost the university just a little over $10,000 per year, funds the counseling center does not have. Though they do not have these funds, they're hopeful there may be other funding here on campus. Reporting for UNI TV, I'm Dakota Funk.